It's Patrik Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated adults and children with tracheostomies and medically complex patients at home, including home TPN, tracheostomy for care for adults and children that are not ventilated, also BiPAP and CPAP ventilation for clients that don't have a tracheostomy. We also give IV antibiotics at home, IV electrolyte infusions such as IV potassium, IV magnesium. We also manage central line, PICC lines, Hickman's lines, and port access at home as well. Now, in today's blog or video blog, I want to give another warning why you can't go home with a tracheostomy without 24-hour intensive care nurses. Well, first off, when you look at on our website at intensivecarehome.com, you will see the evidence-based mechanical home ventilation guidelines, and you will see that those guidelines, those evidence-based guidelines that are a result of over 25 years of intensive care at home nursing in Germany and over 10 years of intensive care at home nursing in Australia, clearly say that you can only go home with a tracheostomy or with a ventilator if you have critical care nurses 24 hours a day. Those critical care nurses need to have a minimum of 2 years critical care nursing experience at a bare minimum. Now, I can assure you, our third-party accredited intensive care at home nursing services, we employ hundreds of years of critical care nursing experience in our service combined. I argue there is no other service in Australia that brings that level of skill into the community, which enables us in the end to look after the highest acuity clients in the community, making sure they don't have to stay in intensive care long term. Right, so going back to 2 clients that we have been working with lately, they inquired for our service and they wanted to take their loved ones home by themselves without any support, because initially they thought there was no funding for the service. Now, bear in mind, an ICU bed costs between $5,000 to $6,000 per bed day. Now, intensive care at home costs about 50% of that. Therefore, clearly, intensive care at home is not only improving the quality of life, in some instances, quality of end of life for patients and their families, it also saves funding bodies 50% of the cost of an intensive care bed. It's therefore a win-win situation. Now, what you can't do is going home without critical care nurses. Some families wanted to take their loved ones home only to learn that their loved ones bounced back into ICU within less than 48 hours, just as we predicted at the time, right? So you can take someone home from ICU or from a ward with a tracheostomy or a ventilator, but you have to do it safely and you have to follow evidence-based guidelines. Once again, use critical care nurses 24 hours a day, and those critical care nurses must have a minimum of 2 years critical care nursing experience. Also keep in mind, we are the only provider in Australia that is third-party accredited for intensive care at home. There's no other service that has achieved the level of third-party accreditation and NDIS accreditation than we have, right? There's no service that has built the intellectual property at home to make intensive care at home possible and also safe. Now, this is not a video to fearmonger, but I can also tell you, and I've talked about this before, that we had some NDIS participants in the past where the NDIS was only funding night shifts with critical care nurses, even though those clients needed 24-hour critical care nurses. And we highlighted to the NDIS and to the families at the time that because there was only funding for night shifts, that during the day, their loved ones' lives is hanging at a thread, because any small medical emergency with a tracheostomy and a ventilator could cause death without a critical care nurse being there. Now, unfortunately, we were right, and 2 clients passed away during the daytime within a short period of time because they didn't have critical care nurses, right? So it's very sad. Make sure it's safe. Make sure you contact us so that you can go home safely. Safety is number 1, and we can provide that safety for you with our critical care nursing team. Also keep in mind, if If you think you can go home by yourself and you think, oh, as a last resort, I can call an ambulance. Now, I can assure you, with the healthcare system in the state that it's currently in, 9 times out of 10, you won't get an ambulance crew that knows what to do with a tracheostomy or with a ventilator, let alone with both. Just heeding a word of warning here, because we are in the trenches and we know who shows up when you call an ambulance. Just keep that in mind as well. Now, if you have a loved one in intensive care, or you want to go home in a similar situation where your loved one is ventilated, has a tracheostomy, maybe you're watching it yourself, you're stuck in an ICU, you can use a mobile phone, you can use an iPad, and you're watching this video, you want to go home, please contact us, contact us at intensivecarehome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecarehome.com. And if you don't have a tracheostomy, but you need BiPAP or CPAP ventilation, please contact us as well. If you're not ventilated, but you have a tracheostomy, please contact us. For all of those scenarios, you will need 24-hour critical care nursing at home. If you need home TPN, home IV infusions, IV antibiotics, IV potassium infusion, we can help you with that as well. We manage PICC line, central lines, Hickman's line, as well as port catheters at home as well. And if you want to find out how to get funding for our service and how it all works, once again, please contact me on one of the numbers on the top of our website, or send me an email to info@intensivecarehome.com. Currently with Intensive Care at Home, we are operating all around Australia in all major capital cities, including all regional and rural areas as well. We are currently an NDIS approved service provider, TAC in Victoria, iCare in New South Wales, and IISQ in Queensland, as well as a DVA approved service provider Australia-wide. We have received funding through public hospitals, through departments of health, as well as through private health insurances. Now, I also encourage you to have a look at our case studies on our website. Now, we also offer NDIS Level 2 and Level 3 support coordination. If you need an NDIS plan, or if you're not happy with your current NDIS support coordinator, please reach out to us as well. Now, and if you're an NDIS support coordinator and you're looking for nursing care for your NDIS participants or any other case manager, please reach out to us as well, especially if you're struggling for nursing care for any of the situations that I mentioned earlier, and you don't know how to advocate for nursing funding with the NDIS. We're also doing nursing assessments for the NDIS, so please reach out to us as well. Now, if you are a critical care nurse or a pediatric critical care nurse with a minimum of 2 years ICU, pediatric ICU, or ED experience, and you ideally have a critical care postgraduate qualification, we want to hear from you if you're looking for a career change. We're currently having positions in Melbourne, Sydney, and Brisbane. We absolutely want to hear from you. We also currently hire in remote areas in Victoria, such as Bendigo and Warragul and Leongatha. Now, if you are an intensive care doctor, intensive care specialist, and you have any bed blocks in your ICU, please contact us. We can help you to manage your exit blocks in ICU. Bed tap by eliminating long-term stays in ICU. We also have our own intensivists on our books, and we're currently expanding our intensive care medical team. We want to hear from you as well. And if you are a hospital executive and you're watching this and you have bed blocks in your hospitals for long-term ventilated adults and children with tracheostomies, etc., we can help you managing your beds in a hospital. We currently also provide an ED bypass service for the Western Sydney local area health district. If your hospital needs critical care nurses in the home to avoid ED admissions, we can help you with that as well, and we want to hear from you as well. Now, thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care and intensive care at home. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.